August is Spinal Muscular Atrophy, or SMA, Awareness Month, a time dedicated to highlighting the urgent need for early diagnosis, ongoing research, and support. Neuromuscular specialist at Palm Beach Neurology, Dr. Manisha Korb, joins us to discuss the SMA patient experience and how recent advancements help people maintain their autonomy and independence. Doctor, thank you so very much for joining us today. So for those who aren't familiar, what exactly is spinal muscular atrophy, or SMA, and how is it diagnosed?
Hi, I'm so happy to be here today as a paid spokesperson for Genentech to raise awareness about spinal muscular atrophy. SMA is a genetic disease that causes a breakdown of muscles in the body, which can lead to progressive and sometimes debilitating muscle weakness, which can affect someone's ability to breathe, swallow, or walk.
Oh, wow. Okay, so how does SMA specifically impact a person's daily routine and their overall sense of independence?
Yeah, as the disease progresses, there can be a breakdown of ability to do basic daily activities such as getting dressed or being able to use a computer, being able to use their hands or their legs. In more severe cases, it can also affect one's ability to swallow or breathe. And the severity really varies widely based on the age of onset of symptoms as well as the type of mutation that they have.
Okay, the treatment landscape has evolved over the years and how, we treat rare diseases, especially SMA. So can you tell us about Evrysdi and, what are some of the considerations you have when recommending it to your patients?
Yeah, absolutely. So for the longest time, the only way we had to treat SMA was with supportive therapies, things like physical therapy, ambulatory assistive devices. But in the last 10 years, there have been massive leaps in the space of disease-modifying therapies. And these are therapies that treat the underlying root cause of the disease. The one I'm going to highlight today is Evrysdi, as you mentioned. And so this is the first FDA-approved medication that is orally administered for SMA patients. It's FDA approved for ages 0 up into late adulthood. And it's available in two forms, liquid or tablet. The tablet form is for those older than age 2 and more than 44 pounds. Liquid is for all ages. And basically, this medication helps sustain the health of the little proteins that sustain the health of the muscles in the body. So it can help slow down disease progression, stabilize disease, and in some cases, even help a person be stronger and meet the motor milestones that they otherwise would not be able to achieve.
Wow, it's very impressive. Okay, so for our viewers who might be navigating an SMA diagnosis in their own family, what's the most important piece of advice or hope that you can share with them today?
So the most important piece of advice is that there are newer advancements in disease-modifying therapies. So while this disease may be something that you were born with and may carry for your whole life, you can change the overall course of your disease progression if you have a disease-modifying therapy that can slow things down. So it's important to talk to your healthcare provider about what option may be best for you, as well as visiting Evrysdi.com if you are able to do so. And then one thing I also want to mention is the possible side effects. All medications have possible side effects. With Evrysdi in adults, the most common side effects are fever, diarrhea, and rash. Having an orally administered medication, though, can provide a more convenient and consistent daily routine.
Doctor, thank you so very much for your time today. But before I let you go, where can we go to learn some more information?
I encourage everyone to check out Evrysdi.com for more information and also talk to your healthcare provider.
Doctor, thank you very much for your time today. It's been a fascinating conversation. And folks at home, if you want to watch this segment again or others like it, just head over to First Coast News Plus.